At the heart of Kenya's new health financing model, the Social Health Authority is meant to pay hospitals for services already delivered. On paper, it is a simple idea, but in reality, it is proving to be a messy affair. Health Cabinet Secretary Aden Duale told reporters this week that SHA is bleeding cash in the billions through fraudulent claims by hospitals. But healthcare providers that we spoke to see that accusation is a convenient smokescreen, one that shifts attention away from deeper systemic failures. They lament that the platform meant to usher in a new era of efficiency has seemingly become a slow presser, one that is not violent but is constant and draining. So much so that the impact of the non-payment to hospitals by SHA continues to impact on the operations of such facilities, grounding one service after the other.
From SHA alone, we have a debt of 17 million, and the old debts inherited from NHIF is 29 million. When you look at what you expect and what you are paid, they are trotting somewhere between 5 and 9% of what you expect. That is not enough to run any business. That eats into your reserves.
The severe financial crisis driven by delayed SHA reimbursements has pushed hospitals to the edge, with majority forced to downsize, lay off staff, and even scale back on essential services just to stay afloat. These are the sites that have become synonymous with facilities that continue to choke under the weight of SHA debt owed to facilities. With no staff to take care of patients, majority of hospitals just like this one have been forced to scale down. Like this facility, managers and administrators of accredited hospitals across the country say reimbursements are barely happening. Claims submitted months ago continue to gather dust and remain unpaid, even as patients continue to receive care.
What makes it most painful is that they reject after they have approved. Now, when they approve a procedure, it means the hospital goes ahead to offer the service to the client. The client has gone home. Then after 3 months, they reject the claim, essentially meaning the hospital will lose all that money. If they would be rejecting the request for the procedure so that the patient knows that SHA is not paying, that would be safer for us. And that's why patients are saying SHA is working, because they have been given the service. But at the end of it, the same request is now rejected for the hospital.
St. Mary's Hospital Mumias is among facilities that were forced to close its doors at some point in 2025. The facility was forced to shut its doors after SHA failed to settle claims amounting to 180 million shillings, leaving patients who depend on the facility for health services stranded and threatening the very tenets of universal health coverage that the authority is meant to help achieve.
SHA isaidii ukikuja mara uwezi kutubiwa kwa SHA, sasa tutaishi namna gani?
Kuna pesa ambazo tulikuwa tumefanya kazi kabla ya hospitali ifungwe ambazo hatujapata, bado ziko under review, tunangojea na tunaomba ya kwamba SHA office watusaidie ili tupate kile kidogo kiko kule cha hospitali kitufikie, kituwezeshe kusonga.
Service providers now claim the real fault line runs across the SHA internal systems. They allege automated bots that are used to process claims have been tweaked to routinely reject submissions, regardless of merit.
What we are saying is that the system is actually almost designed to have the claim fail. Yeah? It's almost designed to have the claim fail. So such that it looks highly suspicious that it's almost an income versus expenditure model.
While official figures touted by the Ministry of Health show that the Social Health Authority has allegedly lost at least 11.6 billion shillings to fraud, IT experts argue that inconsistent file naming, intermittent uploads, and clerical slips can trigger rejections, leaving facilities without a dedicated IT capacity exposed. This, however, they explain, does not necessarily mean that they are perpetrating fraud. It simply means that they are ill-equipped for a system that requires near-perfect paperwork.
They keep changing the rules. And if they change the rule today, they expect you to have complied yesterday, which is not possible.
The intentions and even the architecture of SHA is very good. It is only when they decide that they are more legal than the provider, then that becomes a problem. Putting up hurdles on claims management, putting up hurdles on payment, claiming fraud, those are the problems.
As some of the legitimate claims stall, catalyzing the long credit lines and impacting on service delivery, the Ministry of Health maintains that the new system is helping weed out long-standing fraud that had held the former National Health Insurance in a chokehold. But is that the case?
Currently, we have achieved an average claim settlement rate of 73% across the board. This means that money is flowing to our hospitals, ensuring that facilities remain stocked and operational.
Only 27% so have received any payment in the month of January.
Hospitals are drowning in debts, owed 33 billion shillings in NHIF arrears and an additional 43 billion in SHA reimbursements.
In 1 year, SHA had accumulated a debt of 43 billion. Yet, in 6 years, the debt that NHIF owed was 30 billion. So, is such a system sustainable?
In August 2025, the Ministry of Health suspended at least 40 facilities across the country over fraud allegations. In September of the same year, CS Dwale submitted 1,188 files to the DCI for investigations over fraud, following a forensic audit of SHA's digital system.
Now we are daring you to go ahead, arrest the SHA officials who authorize these payments, take individual and collective responsibility as a ministry and as a social health authority, and also let us see what happened to the hospitals that are abating it. And we want to see all hospitals which are affected, public, private, mission hospitals that are caught up in this saga. No more talking, we want to see some action.
But as institutions trade blame and accusations fly across press conferences and boardrooms, it is patients who remain stuck in the crossfire. And as the war of words continues, the big question remains: who is gaming the system and who is ultimately paying the price? Gloria Milimu, KTN.
Thank you, Gloria, for that report. At the center of these